normal heart beats at around about 60 to 100 beats per minute when someone is resting. But someone with atrial fibrillation, this may be increased to over 140 beats per minute and may be irregular. You can detect this when caring for someone by a pulse check. In the heart of someone with this condition, the upper chambers of the heart, called the atria, contract randomly and so fast they do not allow the complete filling of the chamber in between the contractions. Therefore, they reduce the efficiency of the heart. There are around about 500,000 people in the UK with this condition, and it's the most common heart rhythm disturbance. The condition affects a person by fast, irregular heartbeat, out of breath, dizziness, as well as other symptoms, but in some cases, the person may have no signs or symptoms. It can affect adults of any age, but affects more as you get older and more men than women. Around about 10% of over 75s have the condition, and this risk is increased by people who excessively smoke or drink. It is also more likely to affect people with high blood pressure, heart valve problems or other medical conditions. There are different types of atrial fibrillation, and these have different effects on the patient. One of the types affects the person and it will usually stop within 48 hours without any treatment. There's also persistent atrial fibrillation. This lasts for longer than 7 days or less when it's treated. Long-standing persistent atrial fibrillation, this lasts for longer than a year, and permanent atrial fibrillation, this is present all the time, and there are no more attempts to restore a normal heart rhythm. Although uncomfortable at times, someone with atrial fibrillation can lead a normal life, and the condition can be controlled with medication, but it does increase their risk of stroke. Treatment can vary depending on the person, but includes medications to control atrial fibrillation, medications to reduce the risk of stroke, or maybe even having a pacemaker fitted.